Now, a man who has haemophilia and was infected by contaminated blood in the 1970s has told the public inquiry sitting in Northern Ireland that he has lived a life of fear, paranoia and anger. Speaking for the first time about his experience, the man from Londonderry said it's only recently that he'd been offered therapy. Our health correspondent Marie-Louise Connolly has been at the first day of the inquiry. The first witness we heard from was Paul Kirkpatrick. Tell us a bit about him then.
That's right, Conor. The first witness we heard from today was Paul Kirkpatrick, who's 53 and from Derry. His testimony was personal and delivered in a heartfelt way so that we couldn't help be gripped by what he was saying. He told the inquiry that as a result of having haemophilia, he received contaminated blood products as a child in the 1970s, which led him to contracting hepatitis. He said he had lived his life ever since feeling he was a public health risk. He said he felt unclean and he had been paranoid that his children and his wife, who'd stood by him all these years, would be infected. It was a life lived in fear, one in which he had batted away clouds, including the risk of potentially developing conditions such as AIDS, CJD or potentially cancer.
We're continually exposed to major life-threatening events, and it's continual. It's a whole my life. I go by decade by. That's how I remember things. I've got a wee prompt card of dates, and it's decade by decade. So, I had no choice in the matter. My wife, unfortunately, signed up for it when she married me. So it's difficult. We both have to manage. It messes with your head.
And he wasn't the only witness on the stand, was he? Yeah,
that's right. There was a lot of raw emotion from that witness stand today. Paul is the first of 14 witnesses who are going to be giving evidence over the following 3 days. It was both hard for the witnesses to deliver and, I must say, as equally disturbing to listen to. Bear in mind, some of these people have been waiting 30 years or more for this inquiry to begin, so this has been a hugely significant day for them. Some are taking part, Conor, anonymously. It will also hear from those infected and, interestingly, others such as children who have watched a mother or a father suffer and whose lives have been directly affected by this scandal. One such person is Brigid Campbell. Her father was a haemophiliac. Malachy Devlin died in 1990, having been infected with HIV in 1983 from a contaminated blood product, something they couldn't talk about even to family at the time. The inquiry was told a disturbing story of what happened after their father died and how they'd had to cope with the stigma surrounding HIV and AIDS at the time.
The Undertaker will quite vividly describe how he received my dad's body in what he called a disaster bag from the Royal, and was under a lot of stress to make sure that he dealt with that appropriately as arranged. So that the arrangement was that the coffin was allowed to be open for one night, with strict restrictions.
We will hear from a total of 14 witnesses this week, all with very different testimonies to share. Ending his evidence, let's hear from Paul Kirkpatrick again, and he made this appeal.
We have to stop this from happening again. It can't happen. So we have to me, it's very much we have to learn. We have to get to the bottom of this. Doctors have been put in positions which I believe probably unfair positions where they've had to tell us we've only got contaminated blood or dirty blood for you. They should never have been put in that positions.
Now, this is part of a big expose, isn't it? What's the Northern Ireland element? How significant is it that they've come here?
It's very significant, Conor. As you say, it's a UK-wide inquiry, which the inquiry chairman, Sir Brian Langstaff, said again, it was into what has been called the greatest tragedy in the history of the NHS. He said it was important that he had come to Northern Ireland, that he had come to people living here, as he had said from the very start of the inquiry, that he would put people first. Now, as with most public health inquiries, again, we are seeing the pain that people have to go through publicly in order to get justice. This one will also hear allegations of a cover-up within government and the health service. Who knew what and when? And just finally, Conor, something new that has emerged today is the huge financial disparity that exists between those affected across the UK, with, it has to be said, Northern Ireland being at the very bottom of the pile. In England, a financial uplift was announced on day one for those affected there of the inquiry last month. That hasn't happened here. Instead, people are being told that it's a devolved matter. And while we all know what that means, it could potentially be a very long wait.
Indeed. Thank you, Marie-Louise.